Why we review our clients every year. Many people think enrolling in Medicare is the finish line. In reality, it's just the beginning of the Medicare journey. Life changes, your health changes, doctors change, prescription costs change, and Medicare plans change every year. That's why annual reviews are so important. Not because we're looking to change your plan every year, but because we want to make sure your current plan is still the right fit for your needs. Let me give you a few real-world examples. A client recently called our office after trying to schedule an appointment with their doctor. The doctor's office told them they no longer accepted their insurance plan. The client was surprised and said, "I called to schedule an appointment, and the office told me they don't accept my insurance anymore. Nobody told me." Situations like this happen more often than people realize. Doctors can leave networks. Medical groups can change contracts, and sometimes a plan that worked well last year may not work as well this year. Here's another example. A client had been taking the same medication for years. Everything seemed fine. Then one day, they went to refill their prescription and discovered the cost had increased significantly. The client called and asked, "I've been taking the same medication for years. Why is it suddenly costing so much more?" The answer was simple. The plan changed, the medication coverage changed, and nobody had reviewed their options. Sometimes the biggest surprises aren't caused by your health, they're caused by changes to your coverage. But not every annual review is about solving a problem. Sometimes it's about uncovering an opportunity. One client told us, "I'm healthy. I rarely go to the doctor and don't take many medications. A few years ago, I chose a Medicare plan because it offered a good over-the-counter allowance and money back on my Medicare Part B premium." The client continued, "Everything seemed fine, so I assumed my plan was still the best option. I never thought annual reviews were important. During our review, we discovered newer plans had become available since they enrolled. One offered a larger Part B giveback. Another offered stronger dental coverage, and another provided benefits that better matched their current needs. The client wasn't unhappy with their plan. In fact, they thought everything was working exactly as it should. They simply didn't realize their options had changed. After reviewing their coverage, they told us, "I wish I had done this sooner." That's an important reminder. Annual reviews aren't only for people who have problems. They're also for people who want to make sure they're still getting the most value from their Medicare coverage. Whether your health changes, whether your doctors change, whether your prescriptions change, or whether you simply haven't reviewed your options in a few years, that's why annual reviews matter. During our annual reviews, we look at the things that matter most: your doctors, your prescriptions, your hospitals, your benefits, and any changes that may impact your coverage in the year ahead. At Capstone Health, we believe our job doesn't end when your enrollment application is submitted. We're here to answer questions, review your coverage, and help you navigate Medicare year after year. Because choosing a Medicare plan is important. Making sure it continues to meet your needs is just as important. Don't assume the plan that was right for you 3 years ago is still the best fit today. Schedule your annual Medicare review with Capstone Health, and let's make sure your coverage is keeping up with your life.